Hi, this is Dr. Nick Hayward. I'm here with COVID-19 Long Haul Stories. Today, it's Michelle's story. Michele, please tell us a little bit about yourself, particularly how you were before COVID-19 even came along.
Hi, thank you. So my life is I live in Ontario, Canada. I'm living with my husband and three kids. Before COVID even came along, we were an active family. The kids were heavily involved in sports and theatre and other activities, busy social lives. We were a family that was just on the go. Very, very busy, but also we would have fun together. We're a family that typically eats meals together and finds times when we can, when we're not busy running around after each other's schedule. I work full time. My husband works full time, and yeah, we have a pretty good life here.
Well, that sounds wonderful. Very active family. And you mentioned that you have three children. As I understand, they're in their teenage years. Is that correct?
Yes, somewhere in the middle of this pandemic, my youngest turned 13, and we had three teenagers living in the house during a shutdown, which is fun in a lot of ways, and a whole lot of fun in other ways. But they're great. They get along. They've got each other for company. They kept each other busy, and at times they could keep themselves, take care of themselves while we were both working. So yeah, it's an interesting, lively household. Discussions have been very lively this year at the dinner table because we've had dinners together now every night since the shutdown, which we weren't having before because of activities.
Understood. It sounds like an interesting dynamic. And with three teens, I imagine there are discussions that span huge different subject matter, locations, ideas. I imagine there's a lot of conversations that you can look back on fondly. With that in mind, looking back, I'd like to take us back to the time where you first started to become unwell. Can you talk us through, please, what was happening at that time and how you became unwell?
So it was kind of, it crept up on me in one way. I had a little bit of a cough in late April. I wouldn't even have described it as I have a little bit of a cough. I would cough every now and then, and I would think, oh, it's just the anxiety of COVID being around, and we were being fairly safe. We were staying at home as much as we could, shopping trip, regular, picking up takeout every now and then. We hadn't been completely secluded, but we'd been fairly secluded. We were spending a lot of time together at home as a family and just learning how to live this new life in shutdown because our area had been shut down since middle of March. We were planning things to do for our backyard because we hadn't had time to get things done, and now we had time because we weren't running around to activities. So we were trying to make the most of things that way. On a Sunday night, I know that weekend, early May, starting the 1st was a Friday, and the cough was starting to come on a little bit stronger. Disregarded. I disregarded it. By Sunday, it was more so. By Sunday night, I was tired. I felt run down, but still couldn't put my finger on it, and went to bed early. And then through the night was woken up with a barking cough, one that just sounded like it just wasn't right. It was a barking cough. My first thought was, if this is the virus, or if it's not, my father-in-law lives on his own, and we're the only contact he has. We were helping him. We weren't seeing him often, but we'd pick up groceries and deliver to his house. And I thought, we need to know. So I'll just go off on the Monday morning, get my test, confirm I'm fine, and then we don't have to worry about him anymore. And that was really my only thought. As I'm driving to the clinic, I thought this was just me being overly anxious and I was basically talking myself down, saying, this isn't COVID and you're fine. So went and got diagnosed. And the first thing that was confirmed through a chest x-ray, she listened to my chest, was So sent me for a chest x-ray, and she came back and said it was pneumonia. That was a little shock because I've never had any sort of respiratory illness before. I've played sports all my life. I'm just a generally active person. Never had any issues. Not a smoker. No concerns. So that it almost confused me, and I wanted to tell her she was wrong. She wasn't. So I went home. She made it clear before I get the test results, you need to go and isolate because at that stage in early May, when I was still under the assumption, having read the headlines, that the symptoms were a cough and a fever, and I hadn't had a fever at that point. I was listing symptoms. She was asking me questions. Have you had this? Have you had that? And I was ticking off a little bit more than I realized that were symptoms. I'd been having itchy eyes. I'd been sneezing excessively, but I didn't know they had anything to do with COVID, so I had never put all of them together through April. So she had explained that to me, and I was sitting there confused by that, confused that I had pneumonia. I came home and I gave myself permission just to rest that afternoon because I wasn't feeling worse in the afternoon than I was this morning with that diagnosis. So I just gave myself permission to rest, just try and filter all the information, and just said to my family, that's it. I'm quarantining from them. I'm just on my own, and snuck into bed and watched TV and kind of enjoyed the evening and sat in my own confusion about it as well. Over the next few days, I deteriorated. That's when I started sleeping a lot more. I was struggling with fatigue, concentration. A shortness of breath was starting to come up. I was finding I couldn't talk without running out of breath. And that's something I talk for a living, but I talk for life. I'm a talker. So even the family was noticing, it's like, you've got nothing. And the one thing that is very far from who I am, because I was a stay-at-home mom for years and years, and was fortunate to be able to say, I get to stay home by choice. So it wasn't that I was stuck at home. I didn't do that role because I felt like I had to. And I was fortunate that our financial situation allowed me to do that because it's where I want to be. I love being around kids. I would have all the backyard neighborhood kids in my yard at different points. Everyone sent their kids to me, and I loved it. I love being the center of that world. It's so much fun. And kids talk, and I love that, and I would encourage it. And all three of my kids, my husband is not the same talker as I am. I'll say I come by it naturally through my dad. But all three of my kids are talkers, and my husband is like, that's on you. And I'm like, I know. So suddenly here I am. I'm not even interested. I don't even want to talk to them. I don't want them to come and talk to me. Obviously, we were keeping a distance, but at one point they came to my door to just chat. And then after a little while, I said, okay, that's enough. Just go away. I didn't have energy for them. I didn't have, I just couldn't, I had nothing. I was sleeping a lot. I was in and out. I was trying to turn up for work and be present. I was working from home at that point online. But I was also telling my work what was happening. And so they were telling me, go rest. I would rest. It was about about 7 days in when I noticed I could breathe better again. So it wasn't that same chest tightness. It wasn't that same complete exhaustion. I forgot I was having constant headaches. I was having body aches. I was taking painkillers, just over-the-counter stuff, sort of around the clock because my whole body was aching. About week 7, I noticed I could breathe better. I was still having shortness of breath. Nothing was gone, but it's like, okay, I'm not down in the depths of this as much anymore. So at that point, a week into this, I was like, oh, okay, I get this. This is this really bad virus that in 2 weeks, because I'm not going to end up in hospital now, in 2 weeks, I'll be over it, because that's the message I'd heard so much. At 2 weeks, I hit that 1 week point where I did actually start to go, okay, I'm going to get better. But for the next 2 weeks, nothing progressed beyond that. And that was something that really by the 3rd week, I was like, this is strange. This is really, I didn't understand it. By that point, our Premier of Ontario had said, if you've got symptoms, go get tested. So I called up public health and they said, okay, it's strange you're not over it by now. Maybe you should go get tested based on your symptoms. And I had developed more symptoms from when I was first there. So the shortness of breath came on, the headaches, the aches and pains. All of this had become a constant part of my everyday life. My ability to concentrate, my ability to be able to hold a conversation and things like that. It was just that's where I was at that point. So with all of those symptoms, and the symptom list was starting to grow. So even in that 3-week period of first speaking up, 3 weeks later, that list of symptoms was starting to be identified as a little bit longer. So they sent me in. The one thing, the COVID care clinic that I went to, the doctor there noticed my shortness of breath. And at that point, I couldn't even finish a sentence without, gasping for air. But my oxygen levels were healthy. They were a 97. No reason to concern. She said, but I am concerned that they're at that level. And up until this time in my life, I didn't even understand what oxygen levels meant. I didn't even know why they put that little thing on my finger. I just did it as a good patient. It was never a problem. I didn't need to know about it. No one in my family has had respiratory illnesses, so I don't know anything about this. So I'm now learning 97 is within the healthy range. She said, but the fact I can't continue to talk, I barely had any energy at that point, and I couldn't get through a sentence. She hooked me up and sent me for a short walk with a nurse. It was a short, slow walk, and it quickly dropped to 92, and she sent me to the emergency room. In the emergency department, they saw me. They tested a few things, did some blood work, did some other tests, and the doctor there came back. She said, this is actually what we're starting to see. We're starting to see patients who have COVID but don't get past it straight away, and that tend to have symptoms ongoing. So go home, rest, take care of yourself. And she was very good at just being very empathetic, but also giving guidance. If the shortness of breath gets worse, if your lips start to turn blue, if all these checklists, then call 911.
So that's incredible that your very acute presentation to the emergency department actually happened many weeks after your symptoms started. So just to clarify for us that timeline, from the time when you started to feel unwell, around sort of late April, the beginning of May, how long was it before you had that episode in the emergency room?
So that was on a Wednesday. It was three weeks and 2 days later.
Wow. So more than the 2 weeks that many sort of associate with COVID-19, but actually, astonishingly, it's sort of as though you sort of was very slowly getting worse, quite an insidious progression. And you've highlighted that the symptom list was sort of growing along that time as well. Is that fair to say?
So not entirely accurate. The most difficult period was definitely that first week.
Okay.
But where my understanding was is that I would continue to get better. At the end of that first week, I was not in the what I refer to as the depths of it, where I could barely get out of bed. But my symptoms didn't my health level was no longer in the depths, but it wasn't getting better. So after 1 week, I went from sort of here to here, and then I just stayed there. And then the symptoms continue to change. Yeah, not explaining it well. So I basically just hit that and maintained that level for a while. So 2 weeks later, when I was confused by the fact I wasn't better, because that's what everyone had said, that's when they started looking at all, they looked at all the symptoms again. I wasn't in the emergency room as, like, I hadn't had to go in through ambulance. They sent me there to get extra tests to check things out, because if it wasn't this, what was it? And let's have a look to make sure it's not something worse. I think at that point, because I wasn't better, because I hadn't continued improving and I just had plateaued, I think what they were trying to rule out were things like, potential for stroke. Was it? They did work on me, like how was my heart? Blood clots, they also looked for blood clots. So I think at that point, because I wasn't progressing, They wanted to rule out that it wasn't something more severe and being overlooked. And when they ruled that out, they just sent me home and said, take care. Does that make sense?
Yes, that makes much sense. It's just astonishing to think that you were so unwell in that first week without anyone helping, sort of managing yourself as best as you could at home. When actually, even though you had some improvement up around sort of week 3, there's still a lot of concern, and there's still sufficient concern for you to be sent to an emergency environment to get the follow-up, to get additional investigations. It just got me thinking about how unwell you must have been at the very start, even though you were trooping through and doing your best to manage it yourself at home. And I think that's worth highlighting, because I think a lot of people, a lot of patients, sadly, are doing their very best to look after themselves at home. But I think the story illustrates of just how unwell you must have been in those early days.
Yeah.
Yeah. What do you think about, in terms of getting better? So starting to look into reasons for this around week 3. What were you thinking about how things might go from there?
So at that point, when the ER doctor had said, we're seeing this amongst, she said, young, healthy adults. And at 47, I was proud to be put in that category, or at least compared to. So I thought, I'll take that. That's when I came home and started looking into it more. And I discovered some online communities. Excuse me. I discovered some online communities that were had formed sort of a month or two before, or at least a month before I was on there, who were sharing stories that were just so incredibly familiar to me. I'm not one who likes to go online for medical research, but I was also aware that doctors don't know, the medical system doesn't know, and they're still learning, and their focus is on saving lives. And my life I was living, so I understood. And so learning from other people's experiences, noticing that I didn't have every symptom that everyone had, but I had all the sort of the top significant ones. There's a body politics Black website put out, and they listed the top 10 symptoms. And I proudly said I scored a 9 out of 10 of their top 10 symptoms, but I still suspect I was a 10 out of 10. Try to be an overachiever. I'm not good at it, because we don't actually own a thermometer in our house. So there were times when I felt chilled. There were times when I felt, and possibly I had a mild temperature throughout that time. I don't know. It didn't matter. If I was a 9 out of 10 or a 10 out of 10, I found my people. And so that was where I really started to learn a lot more about how normal my situation was instead of how abnormal it was.
Okay, that's wonderful that you found that support network. And actually, you also identified that you weren't the only one with this continuation of symptoms. How did these symptoms change over time for you?
Yeah. So what's been fascinating to me is that every other illness I've had in my life, there is that progression of just improvement. You get symptoms, you get the worst in the beginning, and then they improve. You are right. In that first week, I think it wasn't until I looked back at, I really was quite very sick. Nothing that needed to call emergency, to call for an ambulance, but it was and there were some scary times. After that, those symptoms eased up but maintained for a while. So in the beginning, in the first couple of months, I'd say my strongest symptoms were consistent headaches. It took about 5 to 6 weeks before I could get through the day without pain, without like ibuprofen or acetaminophen or whatever the names are, without those painkillers. I think it was about 5 weeks before I stopped taking them during the day, and I still couldn't get through a night because of the headaches and the body aches. So I had the headaches and the body aches, the shortness of breath. My kids were out in the backyard, that we were building gardens. My suggestions and directions that my family then followed. So I take a part in that. So we were building a garden, and I was so horribly sad that I was missing out on that I wasn't a part of it. I'd hear them in the backyard, and I loved being around them, and I was sad that I wasn't being a part of that. So I would go out with a book sit in the sun and just be there. And after about half an hour, I'd be so tired from just sitting there and hearing them, I'd have to go back inside to bed. So I had extreme fatigue. I had shortness of breath. We ended up getting one of the oximeters, which I now know the name of, at home. And it was very obvious. I could feel it. I was out there and it was dropping to the low 90s, which I know is not emergency room call, but I know it's also lower than healthy. Just having too many voices. When the kids were talking by that point, it was just too much. And again, I love being the eye of the storm, and it's all just like too many people talking, and I would come back inside. Sometimes they'd ask me questions, and I'd be overwhelmed by that. So there was definitely the physical symptoms for those first few months. They sort of transitioned into, as the shortness of breath started clearing up, and I apologize, I can't remember the timeline, but I think it may have been around July. And I sent my husband, he was in the other room, and I did the oximeter just because I was having some funny feelings, and I thought I'll test it because I was just keeping an eye on it regularly, and I scored 100, and I had not scored 100. It had been about 2 months, I think. So I actually took a photo and texted that to him, and I sent it to my mum as well. So excited. So the shortness of breath was starting to go. I was able by about 2 months to get through the night without painkillers because I didn't have a headache every night. On the nights that I wouldn't take it early on, I would wake up. I would try and soldier it out. I'd tough it out, and I'd wake up with a headache that I couldn't go back to sleep, and I'd take it. But by about 2 months, there were nights where I didn't need it, and I was thrilled about that. So those symptoms were letting up. But by about 2 or 3 months in, what was happening was my ability I wasn't able to concentrate. I wasn't able to take in too much stimulation. There were times where I'd sit with my family at dinner, which I didn't do that for the first couple of weeks because I just couldn't get out of bed, really. And then I did, and just their talking was just too much. And so I'd have to just, I'd eat and be like, okay, guys, go. I wasn't even involved in the conversation, but people talking was too much for me. There were a couple of nights, and they were starting to notice that themselves. There was a night where I was feeling okay and still tired, but of course I'm tired. I've been through a lot. I just have to build my energy up, was my mindset. So I'd sit in the kitchen as they were doing dishes, my 2 older kids, and they were just chatting, and it was comfortable chat. It wasn't highly charged with any emotions or any strong political opinions, which with teenagers tends to happen, particularly this year. They were just chatting. It was gentle, it was comfortable. And after about 10 minutes, it's like, guys, this is too much. And they said, Mum, you're still not yourself. And that was hard. That was hard. So there was a real concentration thing. And I remember in August, no, it was late July, early August timing. And I was driving with my daughter in the car, my youngest, who just turned 13 around that time. And she was talking to me, and I had to just silence her. I said, I can't talk and listen. Actually, that was in early July. I remember driving her, and I hadn't done a lot of driving, and I put it down to that. But I started to recognize the traffic we have here. It's not crazy busy, and we were still in a fair bit of shutdown, so there wasn't a lot of traffic. But just driving around my suburban streets, it was scary to me. Like I'd suddenly dropped myself in the middle of Manhattan driving. It was overwhelming, and it took everything from me to concentrate, to see cars, to see everything. Not that I couldn't see, but it was more it just felt overstimulation. And so when she was in the car with me in early July, I just said, "See, you can't talk. I have to concentrate on driving." Now I have driven actually into Manhattan. I've driven in Toronto. I've driven in Sydney in the middle of rush hour after getting off a 30-hour plane ride. I love driving. I'm a driver. I have no issues with traffic. And here I am hugging the wheel going, this is overwhelming. And it's just light suburban traffic. And I can't handle my daughter talking. So that was the cognitive stuff that was coming up, that even though the shortness of breath was gone, the aches and pains would come if I pushed myself a little bit, if I had a busier day. but the concentration, the ability to be able to handle stimulation was just not anywhere near my normal level. Yeah. So that kind of stayed for quite some time. And then there was a time, I believe it was in early August or mid-August, where I was driving and my daughter was in the car again, and she was chatting to me, and partway through I said, stop. And she's like, sorry, because she'd learned by now, don't talk to mum while she's driving. I said, did you notice I'm driving and talking? And it was this big moment for both of us. This is getting better. I can do this. And we actually were in busier traffic at that point. So it got better. I'm still there though. I would say in August timing, I had hit a wall there was a new symptom coming up, and so I was still in the cognitive system. So this was the system progression was very much in the early days, a very physical, this is a respiratory illness kind of impact. It was the cognitive stuff that came later that really threw me for a loop. Grateful though to have had the online community to understand that this was also part of people's experience, and suddenly word recall hit. Now, I've had that a little bit when I was pregnant. I've had it a little bit at times. We all get stuck for the right word. It wasn't like that. It was a complete block. I'm trying to find a word and I have nothing, and I can't even describe it to you because I just have hit a block. And that was very unnerving. And it was frustrating. I would be in team meetings because I was working throughout this time. I took a lot of time off in May to rest, and I went slow, and thankfully had a lot of support from work from that. But I was working, and I taught for a living, and to just hit a wall where I can't think of the word. And I'm not sure, the frustration level around that was so impactful, because this is where mentally I'm no longer myself. So not only am I sick and I've been tired and all of that, I'm not in I need to rest this better stage, but it's like mentally I'm not there, and I'm only 47 and I don't know where this is going. And that was a little bit overwhelming too. So that went away with time. I would say these days, most of my symptoms have either cleared up or eased up. So a lot of the cognitive stuff has passed. I do find that I can't do a lot anymore. So as I said before, we were so busy as a family. My husband and I on weekends and evenings would be two different directions, and we'd try and plan our lives so we could come back and meet at times. And those activities that I did with my kids, I would always have a social circle around. So I love driving my kid to this activity because of the parents I'm going to hang out with, and this activity is going to be these parents. And I would help manage teams because I love being in the middle of things, and I love being connected to people. I still find if I have a friend come over, I'm tired by the end of the day. If I took my daughter shopping recently, and I came home and went to bed. I'm able to do these things, but it wears me out so fast. So, and I'm trying to build up my stamina. I'm trying to go for more walks. I'm trying to do a little bit of bike riding, but what I do notice is I have to be very careful how much I push myself. Otherwise I end up in bed, and I could end up in bed for a couple of days. So again, grateful for the online communities, because I learned from others not to push yourself too fast. I learned from so many young, healthy people who were used to running marathons that they would then push themselves thinking they're better, because you feel like you are and you so badly want to be yourself again. And then they would then have a whole new wave of symptoms. And so even when I say I've pushed myself, I've never pushed myself too hard. I've been very respectful of the fact this is something you have to rest your point to heal instead of push yourself to heal. But even it surprises me how many activities just wear me out that aren't very intense at all. So sitting around in my home, I feel like myself. I can have conversations. I'm back on the ball. I love all of that stuff. But if I actually try, I could not step back into my old life at this point.
I have to say, it's quite astonishing to hear the firstly, the entire range of symptoms that you had and how they came at different times over a very, very long period of time that you're describing. And here we are, even 4 months later, physically, the level of exhaustion is preventing you from what before for you were the routine tasks of daily life,
Yeah.
the things that you actively enjoy, the things you genuinely want to do.
Yeah.
Just astonishing. 4 months in, you're finding those activities so much of a challenge. And I think, again, that really highlights how, particularly the range of symptoms, as well as the fact that all this time later it's still problematic for you, it really highlights how variable this illness is among society and how it's very different for different people. Have you seen that variation in the online community where you've been yourself, looking in and finding support? Have you seen a big range in responses to this virus?
Absolutely. I sit here feeling grateful for what I don't have. I didn't have the GI, the symptoms, the nausea, the diarrhea. I didn't have that. I've had some moments of nausea, and because of my knowledge about that, I think, oh, here we go. But then it passes, and I'm so grateful for that. I laughed about that with my husband. I had 3 pregnancies where I had severe nausea and throwing up most of the 9 months for all 3 of them. We've laughed and said maybe I'm just have a higher push away of the nausea because I live in fear of that. So I would see the nausea come in and then it would dissipate. And so I haven't really experienced that, and I'm very grateful for that. I'm grateful that I didn't have a stroke. I'm grateful. I hear other people who they had conditions growing, not conditions, but they had maybe illnesses growing up that have been re-triggered. I didn't have a lot of illnesses growing up, so nothing in my system has been re-triggered. But it just seems to be this fully, you name a system in the body, rashes, skin conditions that have flared up, that have either flared up from something that they dealt with 10, 20 years ago and haven't seen again, or they've never had and suddenly they've got this flare up on the skin. So not only just the cognitive stuff for me, the respiratory stuff for me, but the GI stuff, which I haven't had. So many things. Oh, and the smell and taste, I never did have that. And I keep hearing, well, that's how you know you have it. There's so many people that do have that. And I think what a shame. I read of one poor person who was a chef and she lost her sense of smell and taste. And I think, oh, that would have been devastating. I didn't have that, but I've also heard of so many other people who have all the symptoms but not the smell and taste. So the inconsistency that it affects this person in this way and this person's system and this person's system. There's some consistencies amongst and there's threads, but it's also different as well.
I think that really emphasises how, as both members of society and clinicians within society, we have to be more accommodating of the uncertainty and the fact that really for many patients, this is different between many different people. I've said that a number of times in this series, but also we have a responsibility to appreciate that it's really just not the same for everyone. And therefore, I think we are, of course, this is because it's very new. We're learning as we go. Clinically, it seems very different to anything we're familiar with. And I think what you're describing highlights a need for us all to be more understanding of those who have symptoms that don't quite fit, or of those clinicians that do say to us, I'm not sure. I think this has really highlighted our vulnerabilities and uncertainties in both as patients and as providers of healthcare. I think that's worth mentioning.
Mm.
I'm curious to know, though, you're clearly very mum oriented and you have a big family, very active, busy family. I'm very curious to know how this may have affected other members of the family. If you're open perhaps to sharing some thoughts on that, please.
Mm-hmm. So one of the things in the beginning when I was sick, nobody else was. And if you remember in my story in the beginning, I had some symptoms throughout April that I had dismissed because they weren't listed in the media as concerns of COVID. And our bodies still keep doing what they always did. So Um, my kids had some funny little symptoms as well. But, we're all living in pandemic times. This is times we don't know. This is times I'm still trying to figure out how to navigate. So there's the two aspects of this. My two older kids ended up showing symptoms after some big experiences. I'll speak to one of them decided to go on a long bike ride, an extremely long bike ride. And he doesn't normally do that. He hasn't been on a bike ride for a couple of years, but he was feeling 100% fine, and he had all this time on his hands because school had finished for him, and he took a tremendously huge bike ride. And then within 5 days came down with the fever, the cough, the aches, the itchy eyes, everything, like the full package. And then within a day of that, his sister also started showing signs, and she'd also had a different experience herself that sort of had her adrenaline rush going, basically. And she started to show similar symptoms. And I said, okay, took all the kids off to get tested. My son actually, his symptoms got worse, but then within a week or two, they were gone. I'm like, damn, it's good to be young. Because in my mind, I'm still thinking, because young people don't get this, because this is what the media is telling us. They're teenagers, they'll get it, they'll be sick for a couple of days, and they're incredibly healthy too. We don't, as I said, I didn't know what the oximeter was. I didn't know oxygen levels. My kids, I don't. I know their doctor only through the baby years, but I really don't see them very often. My kids don't have any underlying conditions. They're all athletic and healthy and eat well, and yeah, they do really great. So I'm like, damn, like it hurts me that makes me older, and I'm jealous, and I'm really happy too that passed. My 17-year-old daughter, her symptoms developed sort of a day or two after the test quite significantly, and same like him, and they both went into, and they started describing symptoms that I had experienced but hadn't fully explained to them, because I had, as a mum, was trying to keep them up to date with how I was doing, but also trying to protect them from the scariest stuff. Trying also not to give too much attention in describing every detail to them, because I had to take care of myself and not live in that this is what's wrong with me, but this is how I'm getting better. So I hadn't explained everything to them. And they were starting to describe things, and I would ask questions, and they'd like, yeah, like I was some very incredibly intuitive mum who just reads their minds. But what I was doing was comparing their stuff to mine, and they were both in it. So all three of us, in that first week of, really problematic symptoms, it was that inability to concentrate. Normally when they're sick, it's lie on the couch, put a blanket on, watch a movie, watch an easy movie. They couldn't do it. They're both like, I can't get through the movie. I can't get through the show. It was too taxing. So again, it's that extreme fatigue where you just can't get through. I was paying a lot of attention, a little bit of shortness of breath for them, but just really doing, all I knew at that point was just rest and keeping an eye on them, making sure they could keep breathing, basically. Just that worry of, is this when we call 911 for them? My son, as I said, got through it pretty quick, sort of within a week or so, kicked it, and pretty much thinks he's a bit of a superhero now, which in part 4 months later with my symptoms, I think he is a bit too. My 17-year-old, she followed my path, and she had very similar symptoms all the way through and still does, and she's still struggling with this herself. It's changed her ability to do her schoolwork. It's changed her ability to be social. It's changed her ability to be physically active and manage her stress, because one of her ways of managing stress is to go for a run, and she hasn't been able to go for a run for many months now. So that's been incredibly difficult to watch. I'm grateful that I've had the experience myself in the regard that I know what she's going through. I don't doubt her. I can encourage her to just relax and learn to rest. And these are the things I've learned from myself and from the online community, that this is how we're going to get better. So there's that aspect that I've experienced, that I've been through with my kids. I will say one of my biggest concerns is if there are long-term effects, it may just slow me down much more for the rest of my life. And that's okay. But that can't happen to a 17-year-old. So I do worry about that. I don't know what the long-term effects are on her. So she definitely shows improvements. She just seems to be a month or so behind me. So we're sort of, again, we live in hope, and we have discussions around that, about keep resting, how to take care of yourself. And these are the things we're planning for next year when we're better. These are even the things we're planning for this winter. Yeah, so there's that aspect. But there's also the aspect that in the beginning, when I wasn't myself, that I wasn't able to support my kids' emotions through that as well. So I wasn't there to sit down and have a lot of talks. But, you know, if they were dealing with stuff, I wasn't able to help them through that. And I am their person that they go to. That's my role in their life. So there were many times where I had to say, I'm sorry, I can't. Yeah. And that was hard. Yeah.
Yeah, I can't begin to imagine, because I'm not a parent myself, but coupled with yourself feeling so physically unwell, to know that psychologically you're not in a place where you're in a position to support others is more than a double whammy. Everything you've described in sharing your story so candidly, as someone who provides care for others, has looked after others, the whole neighborhood sometimes. And I have this wonderful image of how things were then. And to think that at a time when, you know, your family needs you, I can't begin to imagine the emotions around those feelings of inability to provide, when that seems very natural for you. So I'm genuinely sorry to hear that. I'm glad that things are slowly improving with the symptoms. But as you say, it sounds like your way of managing that is with optimism. I love how you're making plans for this winter, plans for next year. You know, there isn't any certainty at the moment with air travel or opportunities, but I love the idea of, and actually my family are doing this too. Like, we're thinking about how we can make some plans for the Christmas period, for example, almost the best of intentions. You know, the best of intentions to sort of hope and organise for the best, with that little knowledge that it may not be quite as we intend, but we're sort of trying it. Is that philosophy something that you've been holding on to this time?
Absolutely. I do that anyway. That's sort of something in me. I love to sort of like, hey, let's do this. In fact, last Christmas, I said to my kids, you know what, next Christmas, let's go here. And we talked about going away for Christmas. And that looks very much like that plan has changed, or we're still not sure. So we'll have to wait and see. But I love to plan things and look forward to things. One of the things, so whilst the medical world is trying to figure out what this is about, as a mum, as a human being living in a global pandemic, the shutdown at the beginning, which in Canada happened mid-March, we were trying to figure out what our kids were told at school. They were going on a March break, on a spring break, a 1-week holiday from school. And the leader of the province said, and the schools will be closed for 2 weeks afterwards. And so at that point, I do what I've always done with my kids, try to help navigate the uncertainty by bringing in my experience in life, my logic, my sensibilities, and saying, well, I think, you know, this is likely to happen. I was very wrong many times. And so we discussed that in the family and said, you know what, guys, I really don't know. And that became very much a big theme of the house. And it's hard, because when kids have uncertainty, one of the things that I believe parents can provide is that sense of reassurance and safety within that. At the same time, I had to accept that I've got teenagers and I can't do that. If they were young, there's a lot more things they wouldn't know. or they wouldn't have known at that time that I could have been far more protective of the information they had, but they had access to all the information in the media. And by denying that access would have actually increased the anxiety for them. So I felt it was more important, let's know what's going on in the world. Let's accept that we don't know what's going on, and let's learn to live with that sense of uncertainty for ourselves. So that was kind of what we did in the beginning, to actually not so much manage, like, how do we take control and put a positive spin on this, but how do we learn to live in the acceptance of uncertainty? So we did some of that. And then out of that grew a sense of, well, maybe we can do this, maybe we can do that. So when things started getting difficult, we kind of managed in the moment with, and we don't know what. And coming out of that, part of our recovery is that focus on, we will get better, and we'll get better, and we'll be able to do these things next year. So it's a little bit off for my youngest, who didn't actually end up with any symptoms. And so whether she was asymptomatic or whether she just never had it, and we'll never know. And the same thing with my husband. For her, the losses in her life had to be validated, and next year we'll be able to do other things. And I think that was important for her to have that understanding. It's just for now. And for my daughter, who's still struggling with symptoms, it's a bit of a cheer up, like, hey, we're going to get through this together, and we're going to be able to celebrate this. And we talk about being warriors next year, and, you know, the shirts we'll get when she does a marathon again and things like that. And for me, that's part of our mental health recovery, because I believe that to physically recover, we have to also take care of our mental health. And so we do a lot of work on acceptance of what is and hope for the future.
I think you've wonderfully articulated how all of us have had those moments of feeling somehow slightly useless at moments when, you know, you're just trying to provide things that, you know, in a familiar world, and then suddenly everything becomes unfamiliar because everything changed very rapidly. And I think you have a strategy there, setting these milestones, setting these ambitious ideas, kind of finding something to stay grounded with that allows you then to really progress and actually move beyond that initial feeling of uncertainty. And I agree with you. We have to become more comfortable as individuals and within society with the fact that there are very few certainties right now. And I think your strategy and your words hopefully will be very inspiring to many. So I'm really glad you shared that.
Thank you.
I'd like to ask, this is very much your story, and I'm open to you sharing any messages for others out there who may or may not have had the virus. Based on your experiences, do you have any final thoughts for others to consider?
I consider myself one of the lucky unlucky ones. Lucky I never ended up severely in hospital or worse. But also lucky in terms of the fact that I had so many people around me who have been so understanding, accepted my experience as my truth. My family, my work, my immediate family, my extended family. Nobody's questioned me. Nobody's told me I'm doing things wrong. I know through the online community that a lot of people haven't had that experience. I know that through the online community that not everyone has the privilege and the fortune to be able to continue working through this because they have different work situations to me. And I think my message, I think, is I want everyone to know about this. I want everyone to know that this isn't simply a matter of you get over this in 2 weeks or it's severe, that there's this whole middle ground that so many people worldwide are having the same experience of just being impacted long term. And I think when we as a society start to really understand that hopefully there'll be more understanding for those who are experiencing it and are feeling isolated by this experience, because isolation, it's hard to heal in isolation from anything. So I think we need to understand, offer that compassion and empathy to those who need it. One of the beautiful things I had from friends was, let me know what we can do. And even if there wasn't anything they could do, just knowing that they were there to support me, that's where I really feel very fortunate. With friends every now and then, my family every now and then, just checking how are things going now. Just checking without any expectation that, are you better yet? Because that one is a tough question to answer. Like, oh, are you over that? It almost feels, when I live in my positivity of, I'm getting better, and this is what I'm looking forward to. Are you better yet? No, I feel worse. So even just that, how's the fatigue going? How's this going? Is such a much more compassionate question than, are you feeling better now? But I think we also need institutions. We need the systems to understand. We need, the policies, the political policies around how do we support people. We are going to have so many people come out of this pandemic with long-term symptoms that are not going to be able to work for months, that are going to need more medical support than I've needed for months. Financial stress, relationship stress, these are all going to be ongoing. And if we're not setting ourselves up for that, and we're just focused on how can we stop the virus, if that's the only focus, our world is going to be struggling a lot mentally, psychologically, and physically, for all of those people who don't have the resources to be able to manage through their long haul symptoms. The other reason I would love for the world to really start to understand more about COVID and the long haul symptoms is that so many people are still believing, I'll be fine, I'll get this, I'll kick it in 2 weeks. And so it's okay if I get it. And so they don't have to protect themselves. And I really wish that were true. I really wish that we could just go into herd mentality, the herd immunization, and allow enough people to get it, enough young, healthy people to get it, even if we could quarantine them for a little while and say, you all stay together and get over it in 2 weeks and come back to society. It's not going to work that way, because too many young people are also experiencing the long haul of symptoms as well. And so this part of it is not an age-related thing, and it's not a comorbidity. It's not a sort of other illnesses that you had. I look at my daughter, and she's never had anything like this. I've never had anything like this. No one in my family has had anything like this. There's no reason to say we'll just get it, that we would have extenuating circumstances. And in the beginning, in my family, and I'm a little ashamed to admit this, but I think I really should say it, we were of that mentality too. We were being careful, but if we get it, we'll be over it in 2 weeks, which was a reassurance to my kids. Let's not get too anxious about this. We'll be okay, but we're looking after ourselves so it doesn't spread to our grandparents. Wow, I was wrong. And I don't mind admitting that. But I'm sad that I have to admit that. I'm sad that didn't turn out true for myself, my daughter, and so many others.